In this course, the basic principles of radiation safety are discussed. This module will focus on X-rays specifically, which is a form of radiation. It'll be discussed how they are generated, the effects of X-rays on the body, possible hazards, and how these hazards can be minimized. Radiation is defined as the emission or transmission of energy as waves or particles. Many different forms of radiation exist. These are grouped in 4 categories. Acoustic radiation, consisting of, for example, sound and ultrasound. Gravitational radiation, consisting of gravitational waves. Particle radiation, which is caused by radioactive decay. And electromagnetic radiation, which consists of the electromagnetic spectrum containing visible light and X-rays. Radiation can be divided into 2 categories: ionizing and non-ionizing radiation. Both have specific properties and are used for different means. Ionizing and non-ionizing radiation each have specific effects on the human body. X-ray is a form of ionizing radiation, as is particle radiation. Visible light is an example of non-ionizing radiation. This module focuses on ionizing radiation. Ionizing radiation also exists in the atmosphere as background radiation and can have a natural or artificial source. Natural sources include the sun, gravity, and naturally occurring radioactive molecules such as radon and radium. Ionizing radiation can also be emitted from artificial sources, such as nuclear explosions. This module focuses on X-rays, as these are used to create medical images of internal structures of the patient before, during, and/or after surgery. X-ray is a form of energy, similar to visible light. X-rays move with a higher frequency and higher energy than visible light and can therefore pass through the body. X-ray imaging should be performed in a responsible way, as it can also have negative consequences for the patient and the staff. In the OR, the image is created by using a mobile X-ray unit called a C-arm, as its shape resembles the letter C. This C-arm is placed over the part of the patient that requires imaging. Obtaining these images is important for many different surgical procedures, for example orthopedic, trauma, vascular, urology, and neurosurgery. These images can provide valuable insights into the internal structures of the patient. Pregnancy or breastfeeding is in general not a contraindication for the use of intraoperative X-ray. Extra protection measures can be taken in order to protect the pregnant woman and her unborn baby. When a pregnant woman needs X-ray imaging, extra effort needs to be put into providing justification. When the use of X-ray is expected to outweigh the possible negative consequences, it can be used on a pregnant patient. When an employee who works with a C-arm is pregnant, her working conditions can be adjusted. For example, she can temporarily transfer to a different location where no C-arm is used. Before the C-arm can be used to image the patient, the device and the surroundings should be prepared for use. The C-arm is connected to the power grid of the hospital and to the monitor, on which the image is displayed. Connecting cables should be placed in such a way that the C-arm can be moved freely. The C-arm consists of 2 components, the X-ray source and the X-ray detector. The X-rays are formed at the X-ray source, after which they pass through the patient's body. At the X-ray detector, the X-rays are converted to a digital image. C-arm operation is reserved for personnel who have received specific training and the appropriate certification. These are called radiological medical practitioners. Which healthcare professional is certified to operate the C-arm is dependent upon national laws and regulations. The person responsible for radiation hygiene in a hospital is called the clinical physicist. Exposed employees are classified into either Category A or Category B. Employees who may be exposed to a radiation dose higher than 6 millisieverts, with a maximum of 20 millisieverts per year, qualify as Category A employees. These Category A employees receive an initial medical examination and then undergo periodic inspections. Employees who may be exposed to radiation doses between 1 and 6 millisieverts per year
are designated Category B employees. For Category B employees, there is no mandatory medical examination.
The surgical table is placed in between the X-ray source and X-ray detector, with the patient positioned on it. The table should be X-ray translucent, so it does not block the X-rays. Before the C-arm can be used, it should be covered with sterile translucent plastic drapes. This way, the sterile surgeon or scrub nurse can adjust the position of the C-arm. The patient can be placed on the table in different positions, depending on the image that is desired. The C-arm can be rotated in order to obtain the desired projection. Furthermore, the C-arm should be positioned in the OR so it can be easily placed over the patient when an image is desired. When positioning the C-arm, the legs of the surgical table should not impede its placement. The patient and C-arm could be moved in the cranial or caudal direction in order to avoid this. As the X-ray source or detector are often placed under the surgical table, enough space should be present to accommodate this.
Now the C-arm is ready for use. In order to understand how X-rays are generated, the working principles of the C-arm are explained. When the C-arm is turned on and radiation is present in the OR, a verbal warning should always be given. When the C-arm is in use, this should be indicated clearly outside the OR to prevent people from entering. The size of the beam is regulated by the diaphragm, which determines how much radiation is emitted from the X-ray source. The size of the diaphragm can be adjusted by opening or closing the aperture. The diaphragm should always be as small as possible in order to expose the patient to the lowest possible radiation dose.
This beam now travels through the patient. Some of the beam will be absorbed by the tissue, and some will be allowed through. Next, the beam passes through the anti-scatter grid. This grid only lets the primary X-ray beam pass through and removes the scattered radiation. This will result in an image with improved contrast. In order to create a good image, a radiation beam with a higher intensity is necessary to compensate for the filter, resulting in a higher dose received by the patient. Now the X-ray beam reaches the detector. This detector translates the photon beam into a digital image. Soft tissues generally let the X-ray beams pass through, resulting in a black color on the image. Hard tissue, such as bone, absorbs most of the beams, resulting in white color on the image. It's also possible to create such an image continuously, resulting in the current situation being displayed in real time on the monitor. This form of X-ray is called fluoroscopy. When the obtained image is too small for the purpose it was created, the image can be enlarged. In order to accomplish this, the intensity of the X-ray has to be increased. This will increase the dose received by the patient. Therefore, this magnification should only be performed when it has a clear advantage for the use of the image. When an image is formed, it's possible that several parameters need to be adjusted in order to get a good quality image. This can be done by adjusting several parameters by hand or making use of the automatic settings. A good image is generally generated by varying the current and voltage in the X-ray source. Background noise is always present on an X-ray image, but when too much noise is present, the current running through the X-ray source should be adjusted to correct this. Increasing the current will result in lower noise and higher intensity of radiation that the patient receives. The current is expressed in milliampere. In order to adjust the contrast of the resulting image, the voltage of the X-ray source can be adjusted. A decrease in voltage will result in a higher contrast. Contrast provides better differentiation between structures with similar grey color. Increasing the voltage, expressed in kilovolts, will increase the energy of the radiation. Radiation with higher energy will result in a higher penetration power in the patient, leading to less contrast.
The optimal kilovolt milliampere curve is regulated by the C-arm itself. Depending on the patient's posture, the C-arm looks for the optimal kilovolt milliampere curve with the radiation dose as low as possible and the image quality optimized.
In this module, the units as set by the International System of Units for Radiation are used, as they are the most commonly used. Radiation is expressed as the unit Gray, which is the amount of energy joule per kilogram tissue that is absorbed. This is also called the organ dose. Gray is the physical quantity to expressed radiation. Because the effect of every type of radiation is different, a conversion factor is used. When the amount of Gray is multiplied by this radiation weighting factor, you get the equivalent dose on the body, expressed as sievert. This is the equivalent biological effect of Gray. The units of sievert remain unchanged. For X-rays, this conversion factor is 1. Thus, 1 Gray is 1 sievert. For every sievert a person is exposed to, the lifetime risk of developing cancer increases by 5.5%.
This equivalent dose can be converted to the effective dose by multiplying it with the tissue weighting factor. Now, the effective dose for every tissue can be calculated. Quick dividing tissues like intestinal epithelium are very sensitive to radiation and therefore have a high tissue weighting factor. Other tissues, like bones, have a low tissue weighting factor as they are not very sensitive to radiation. In order to protect the employees who work with radiation, a maximum annual dose is set at 20 millisieverts per year. Employees who are potentially exposed to a dose larger than 1 millisievert per year should therefore wear a dosimeter to measure the radiation dose received. These measurements should be assessed regularly and the working conditions of employees adjusted accordingly. This small portable device should be only worn by one employee. Radiation exposure of patients during medical examinations and treatment is only guided by reference values, not specific dose limits. Radiation is deliberately used for diagnosis and treatments that are of benefit to the patient. Therefore, the balance of what is and what is not an acceptable radiation dose is very different from an acceptable level of exposure for employees. A physical quantity that is a good indicator of patient dose is the dose area product, or DAP. The DAP is displayed on the display of the C-arm in units equal or comparable to Gray centimeters squared. This reflects a combination of the absorbed dose and the area of radiation field that enters the patient. Adjusting the size of the radiation field or adjusting the intensity of the radiation field directly influences this value. If the irradiated organs are known and the tube settings such as kilovolts and milliamperes are known, it is possible to estimate the effective dose that the patient received. Besides the DAP, the estimated skin dose is also displayed in grays.
When an image is taken using a C-arm, the patient receives a certain amount of radiation. The quantity is dependent on the type of image because different amounts of radiation are required to image different body parts. For example, less radiation is required to image the thorax than the abdomen, as the lungs have a higher air content and the radiation can pass through more easily. Because of background radiation in the atmosphere, every person receives an annual dose of ionizing radiation. In 2008, the world population was exposed to an average of 2.4 millisievert from natural sources and 0.6 millisievert from artificial sources, resulting in an annual average dose of 3.0 millisievert for every human on Earth.
Ionizing radiation can also have adverse effects on the patient or surrounding personnel. When human cells are exposed to ionizing radiation, interaction occurs, and the cell can be damaged or die. Additionally, direct radiation can cause injury to the DNA. Most of these damages are repaired by naturally occurring repair mechanisms. When these damages are not repaired, cell death or mutations can occur. This effect can also occur by indirect injury due to free radicals.
The effects of ionizing radiation on the human body can be split into two categories: stochastic and deterministic effects. The chance of stochastic effects increases when the dose of the radiation increases. This chance exists no matter how small the dose. Therefore, there is no threshold for these effects. The most important stochastic effect is the increased chance of carcinogenesis. At a low radiation dose, only the chance of stochastic effects is present. When this threshold is exceeded, the chance of stochastic effects increases and deterministic effects will also start to play a role. Deterministic effects are defined as effects on the patient that start to appear after a certain dose threshold is reached. Deterministic effects include increased cell death, which impedes normal functioning of tissues and organs. Non-ionizing radiation can also have a negative influence on human health. For example, the thermal energy of tissue can increase when in contact with this radiation, causing burns. It is important to reduce the radiation exposure of the patient and surrounding personnel to minimize the possibility of these complications occurring. When the radiation comes into contact with the tissue of the patient, radiation scattering occurs. This scattering could affect the surrounding staff negatively. In order to minimize this scattering, the X-ray source should be placed at the bottom side of the C-arm. One of the most important principles that can be followed in order to reduce the dose received by patients and staff is the application of the ALARA principle. This entails that the exposure of radiation should be as low as reasonably achievable. 3 categories of measures exist in order to achieve this. When reducing the time the patient and staff are exposed to radiation, the dose they receive will also be limited. This is especially important when performing fluoroscopy, as the patient receives a high dose of radiation with this continuous method. When performing fluoroscopy, this principle can be applied by using X-ray pulses instead of a continuous beam. This decreases the time the patient and personnel are exposed to the radiation. Also, the last image hold principle can be applied by displaying the last image obtained during fluoroscopy on the monitors.
Shielding contributes to the protection of surrounding personnel. Shielding is a method that uses physical barriers that absorb scattered radiation. This can be achieved by wearing a lead apron and thyroid shield to protect radiation-sensitive areas of the body. If the employee always wears a lead apron, the dosimeter should be worn outside this apron, on the front of the torso, at shoulder level. Protective eyewear should also be worn. These 3 pieces of protective equipment should be worn by the person performing the X-ray procedure. Surrounding personnel should leave the OR whenever possible, and essential staff required in the OR should wear a lead apron and keep as much distance as possible. The parts of the body of the patient that are not imaged can also be shielded, for example by using a lead apron. This might be done during fluoroscopy procedures to protect employees from radiation scattering.
Safe C-arm use can also be executed by taking the distance between the patient and surrounding personnel into consideration. This is important to minimize the scattered radiation received by the staff. From the X-ray source, the radiation decreases quadratically. Maximizing this distance, for example by placing the monitors at a safe distance from the C-arm, will result in protection of the surrounding staff. Taking distance into account can also protect the patient from excessive radiation. As the radiation dose is the highest close to the X-ray source, the patient should be as close to the X-ray detector as possible. When the patient has a high body weight, a higher dose of radiation is required to create an image, as the radiation will be attenuated. This means that an obese patient will receive more radiation than a slim patient. This will also result in more scattered radiation. Because of the anti-scatter grid present at the X-ray detector site, the dose the patient receives is increased. When performing X-ray images on children, this grid has to be removed when possible. Now, the dose can be decreased. Children are especially sensitive to radiation, as the cells of their tissues are dividing faster than in adults to accommodate growth. In this module, the basic principles of ionizing radiation were explained. The working principle of the C-arm was presented, as well as the effects of X-rays on human beings. 3 categories of measures were presented that can aid in using radiation in a safe way for both patients and staff.